All right. Hello. Good afternoon, everyone. We hope everybody had a good lunch. Welcome back to our first session of the afternoon. Again, I am Rod, and I am so excited to introduce to you our next session and the panelists. So in this session today, we will explore the possibilities and opportunities we have all over the Southeast Asian region in terms of policy and practice. Let's get to know what are bright spots for drug policy with our distinguished panel members who I am very excited to introduce. So first off, we have Gloria Lai. Gloria is the Regional Director of the International Drug Policy Consortium in Asia, a global network of civil society organizations that advocate for evidence-based drug policies. She previously worked as a senior policy advisor on law enforcement and drugs for the Australian government and is currently based in Bangkok, Thailand, where she continues to improve strategies on policy reform and harm reduction all over the region. Hi, Gloria. Next up, we have Dr. Sangeeth Kaur. Dr. Sangeeth is the clinical coordinator at the Center of Excellence for Research in AIDS, or CERIA, University of Malaya, Malaysia, and the vice president of the Malaysian Alliance for Drug Policy Reform. She helped launch the first mobile clinic for drug users and is a member of the Drug Reformation Association, actively pushing to review and amend drug policies in Malaysia. She has received the Award of Excellence and the Best Innovation Award in Malaysia. We're glad to have you here today, Dr. Sangeeth. And last but not least, we have Yohan Misero. Yohan is the program manager of AKSI, Indonesian Act of Justice, which is a non-governmental organization that provides community-based legal aid for people who use drugs in Indonesia. AKSI has 3 community paralegals that can quickly respond to interactions with drug law enforcement in their community. Yohan lives in Jakarta, where he writes papers and press releases to provide community perspectives in the midst of Indonesia's continuing war on drugs. Thank you, Yohan, for joining us. And now I will turn over the floor to Gloria, to Dr. Sangeeth and Yohan. Thank you so much for joining us and hope you have a great discussion.
Thanks so much, Rod. And thanks so much to NoBox and all the co-organizers for making this possible. It's amazing, and it's especially kind of encouraging during these times when we have to spend so much time online and miss seeing so many good colleagues that were able to do so in this warm space. So we have just a 1-hour session today, and yeah, I have a presentation prepared. I'm gonna hope works. So this session is about trying to kind of walk through a process of what we know about responses to drug use and dependence is that it's mostly about criminalization and then a wide range of punishment. But if we weren't to do that, and I saw that this morning, and of course in the previous few days, there's been these wonderful sessions about harm reduction and about what works when it comes to responding to approaching like people who use drugs and people who are dependent on drugs and people who need treatment. And if they are to be able to have those opportunities for them instead of criminalization and punishment, what could that look like? And just also say thank you also to Dr. Sangeeth and Yohan for joining us. It's so wonderful for us to be able to do this together too. So thank you. We're hoping that this will be a really interactive session. So really inviting your inputs, your comments, your questions in the chat box. And we're going to take turns co-facilitating each segment. So the first one is led by Dr. Sangeeth. So Dr. Sangeeth, I hand over the time to you.
Hi, good afternoon, everyone. I'm really glad that we've taken out some time to talk about decriminalization and drug policy reforms and drug laws, which I think it's really crucial at this time because we've all done a fantastic job with harm reduction. Even in Malaysia since 2005, we've done a fantastic job in harm reduction. But one thing I must say that in Malaysia, harm reduction was implemented for the reduction of HIV cases in Malaysia. I wish it was put under as a pillar for drug treatment and rehabilitation. So we are having a bit of challenge in sustaining harm reduction as we've managed to reduce the number of HIV cases. So a lot of advocacy needs to be done in harm reduction in Malaysia for drug treatment and rehabilitation. But I think it's so crucial that we incorporate drug policy, drug laws, decriminalization into the harm reduction strategies. So for me, the lessons that we've learned about criminalizing and punishing people in I think most of the countries in our region. So just a few of the important things, the effects that the current drug policies have made on I'm sure on most of our countries. So yeah, so towards I think that's what we're all looking for, towards an effective response to drug use epidemic, not only in Malaysia but everywhere. So if we say that we do not want to criminalize drug users, so what do we need to do? Now there's a lot of things that we need to, because we can't get it wrong this time. Yeah, so Malaysia, like many countries, we have very punitive drug laws. We have the Dangerous Drug Act since 1952, Drug Dependence Treatment and Rehabilitation Act, which was introduced in 1983, where drug use was declared as Malaysia's number one enemy. And that's when we started the drug rehabilitation centers, and then we have the Poison Act and the Dangerous Drugs. So many drug acts, many punitive laws, So what has happened with all this? One, I just want to touch a bit on the drug law reform. What has happened with these drug laws, and what are the implications that we've seen with all this Dangerous Drug Act? And at the moment, our goal is to replace convictions with health referrals. That is what we mean by decriminalization, towards an effective human health and social services, and also ensuring proportionality of sentencing. So we are not saying that we want to legalize drug use, but not to misunderstand what decriminalization is, but is to just replace these convictions with health reference. And so some of the legal issues that we've identified is that in the Dangerous Drug Act, we are still criminalizing drug use and possession of personal consumption. We have not distinguished between drug trafficking and for possession for personal consumption. Punitive laws as barriers. So for harm reduction in Malaysia, one of the biggest barriers has been the punitive laws, whereby if they're on methadone program, they were still being arrested because the laws were still there, and they were still allowed to arrest our patients on methadone. Evidence-based and measurable drug control laws. Yeah, so this one is on the prohibitions and the to enforce on the convictions and the item seized is just too generalized. Disproportionate sentencing, whereby someone is arrested with just 0.04 grams of meth for personal use, can still be charged as drug trafficking, or someone with 200 grams of marijuana has death penalty and very heavy sentences. So disproportionate sentencing, application of multiple statutory presumptions in Dangerous Drug Act. So presuming that if he has that he's carrying something that is not known, that we can presume that he's a drug trafficker. Of course, the compulsory drug detention centers, where I think UNODC has since 2012 has asked many of the countries to close down compulsory detention centers. We are still working on that. And of course, unregulated private rehab centers, which are still in the Dangerous Drug Act. So these are some of the legal issues that I think that's important, that first we need to look at the drug laws in the country. Yeah, of course, over time implication, most significant, especially during the pandemic now, is we've realized is that the overcrowding in prisons, and because of the increase of COVID in Malaysia, we've realized that most of the inmates are in prison. About 60% of them are for minor drug offences. Like, do they really need to be there? And I'm glad that now we have organized a parliamentary group to address this issue, to reduce the overcrowding and to look at the drug loss. And we know that according to UNODC, not everyone needs to go. Anyone who uses drugs don't need to go for treatment or be incarcerated. And according to UNODC, only 1 out of 10 drug users is a problem drug user, and only 1 in 6 problem drug users have access to treatment. And another, we have done some research in the prisons, and these are all the health impacts of incarcerating people who use drug use. So among the drug users we've tested for latent tuberculosis, almost 88% of them, of the prisoners, have latent tuberculosis. And not only the prisoners, but the staff in the prisons have 81% have latent tuberculosis compared to those in the general population. So by incarcerating them, we are not only putting them at risk of infectious diseases, and which indirectly the public health prison health is also public health, because they will come back to the community and indirectly increase the risk of tuberculosis in the community. And we also did a study whereby we were very lucky in 2000. There was a paradigm shift where the Ministry of Home Affairs actually tried to decriminalize drug use, where they converted 10 of their compulsory detention centers to voluntary-based centers. I was part of the process. It was very, very exciting time. And we did a study to compare Puspen are the drug users in the compulsory centers compared to CNC participants, which are volunteer-based. So when we did a long 1-year study, we saw that most of the inmates from the drug users from the incarcerated settings relapsed after 31 days, compared to those who were at the voluntary centers, who actually relapsed only after 352 days. So the voluntary-based participants had 81% decreased chance of opioid relapse compared to those who were incarcerated. So I think this evidence, we need to show this evidence and highlight, because to our governments, to if we are going to advocate for policy reform or drug law reforms. Another big thing I think is very important for all of the countries to look at the cost of criminalization of drug use to our country. So there was a study done on the cost effectiveness of incarcerating drug users. So based on that, it was estimated that we could save. It was estimated that we spent 102 million ringgit on by incarcerating drug users, about 42 ringgit a day, and also courts and prisons. And it is so important that if we decriminalize drug users, these resources can be allocated for more serious criminal cases. And of course, the multiple mechanism of diverting, the importance, if we are going to decriminalize, is to to look at all the drug laws, and also to increase and strengthen the community-based treatment and institution-based treatment. Yeah, so this is just another comparison of the cost that the government needs to spend. If someone is in prison, per patient is 20,000 ringgit. In the compulsory detention centers, almost 38,000 a year. Whereas if they can be treated in the community, it's almost 1/5 of the cost. Yeah, this is the annual cost. Again, you can see that the cost of in prison is almost 3 times the cost if we could treat the patients in the community. Not only the cost, with the same amount of money, we could treat many more drug users in the community. Yeah, so we still stand by this statement that was given by all the UN agencies, that compulsory detention centers and rehabilitation centers should be closed down to look at more voluntary-based, community-based programs. Yeah, so like we say, Insanity is doing the same thing over and over again and expecting different results. And it's time that we take steps that to actually change what we've been doing for the last 30 years. Yeah, so I think this is for the next session. Yeah, thanks, Gloria.
Sorry, thank you. I think I say encourage people. I know there's some questions, but maybe I think we can definitely address the questions towards the end of the session as well. But just going back to the question that was asked, also invite you to share any reflections on what lessons have we learned, and you could just be about you and what you've seen. Could be what you've seen other people learn or your government learn. So welcome. Yeah, would love to hear your experiences too. While we hold on to that, I also go on to the next, another question that we had today. And I'll let Yohan lead on this question actually.
Hello, everyone. Good afternoon. I guess Jakarta and Manila time is not really different, right? Just 1 hour difference, if I'm not wrong. So the session is about how could we respond to the situation that emerging in our reality today, and of course, every government has their own way of thinking, has their own situation, has their own political climate that they have to adjust. And so we welcome your comments. We welcome your thinking about how government respond to the situation towards people who use drugs in your respective situation. Just for some backgrounds, in some Southeast Asian countries, I think most of Southeast Asian countries, there is this approach called mandatory rehabilitation. Indonesia has that kind of approach somehow. Not in a way that my government go to the streets and bringing people to the rehab centers, not like that. But the law demand the people who are, I think, older than 21 years old and have some addiction problem to report themselves to the government. That's the approach of my government. If you are not report yourself, if you don't report yourself, then in a criminal law sense, you are liable to bring to the court. Even though with this difficult situation, I think there are some things that you guys can learn from or just know the situation in Indonesia's reality. So Indonesia, we have harm reduction and have program. I know sounds boring, but in some jurisdiction, it's not really the situation. So if your country have such programs, it's actually something to rejoice or to be happy about. Though in Indonesia situation, the harm reduction program is still in a sense of HIV response, and in a classic HIV response, and with the current flow of meth, which has happened in almost every Southeast Asian countries, this create a new problem, since people who inject drugs, at least in Indonesia situation, is not as the number is not as high as before, and harm reduction that is needed with the meth epidemic today we have is not really in place. So the harm reduction activists on talks with the government to allow them to be more creative. But at the same time, that is something to be happy as well, since the dialogue is happening. It's not really becoming anything yet today, but the chances to have a dialogue with with the health ministry and the AKSI authorities in Indonesia, it's still, I think, I kind of hopeful that it can be fruitful one way or another. We have also harm reduction and rehab program in prisons. It's it's actually contradictive, right? But at the end of the day, it's still better than nothing. I prefer my colleagues, my friends, it's outside the prison, of course. I think they deserve that, and but but the reality of drug use in prison, for example, it's better that there is a rehab or harm reduction program in place. So that is Indonesia's situation. But at the same time, I have to say that the program in prison is also declining. It's not really massive anymore, and and it's we're struggling to have those kinds of program back in prisons. The other thing that I want to say that, as I mentioned earlier, that Indonesia is still criminalize people who use drugs in many aspects. If you use drugs, if you possess drugs, if you buy drugs, and if you plant some drugs, since some drugs can be planted at your house, right? But in the law, in our current law, 2009, which is now it is 12 years old. I'm not proud of that law. That law make the prison in Indonesia like threefold of its actual capacity. But there is an option for rehab when you're face to face with criminal justice process. Um, the police have certain kind of regulation that allow them to divert you to the rehab centers. The prosecutors may prosecute you to the rehab, and the judges can judge you, sentence you to go to rehab centers. But at the same time, it's a matter of consistency, right? Sometimes they do that, sometimes they don't, and it will that will bring us to the work of my organization. We can do it later. But the matter of consistency is really important. The regulation is in place for the law enforcement from the police to judge, so they can divert people who use drugs from criminal justice process to rehab centers. But it's not really happening every day, and that is something that I think if government responds towards if criminal justice process and diversion is the main thing of your response, it's important then to control the consistency of that initiative. The third one that I want to mention is that so the 2009 law, the record that I was mentioned before, sending massive wave of people to the court, right? Because it is the police or our narcotics agencies to cut people and bring it to the criminal justice process. The Supreme Court realized this, and they know that too many people in court affect their work because they have to face many cases like this. Just only because people, like, let's say, possess 1 milligrams of shabu or 1 joint of cannabis, then the court has to spend 3 months, judge the person, right? So in 2010, 1 year after the enactment of the 2009 law, the Supreme Court then released a circular letter to their judges. They said if you find a person possess 8 kind of drugs, it's only 8. The most popular one, like I think there is cannabis, there's MDMA, there's shabu, there's heroin, and for LSD is in the circular letter as well. Under a certain amount, we can sentence them to rehab, and that is a really really useful regulation, since the law, the 2009 law, doesn't provide us with that. But since the Supreme Court provide us with that circular letter, we can use that to then advocate for our friends situation in court. Once again, the problem is inconsistency. The circular letter is there, but will the judge use it or not? Will the judge take their Supreme Court circular letter seriously or not? It's not up to us anymore, right? It's up to them. And in every single hearing, we try to remind them of that circular letter. In every defense note, we remind them of that circular letter. But sometimes the police or the prosecutor or the judge themselves just ignore it. So it's also important to, I think, make the regulation more in a stronger position than a circular letter. Maybe that will, make the judge more into comply with the regulation. The fourth aspect that I want to share with 97,000 people here in the room is about the civil society initiatives in Indonesia. We're not the best country in drug policy, of course, but there's always, I think I have to be thankful uh, since somehow we can still talk with our governments and with our parliament members about this. It's not really the situation in many countries. Let's say in HSAFI programming, the representation of people who use drug is still on the table. They can argue the importance to address the needs of people who use drugs. And today, the civil society, and including people who use drugs as well, try to go to the constitutional court so we can have a medical cannabis policy soon. It's also an initiative from the civil society. We also thankfully have the chance to work with other issues, other activists and other issues, though we not really, up until now, is not really go hand in hand with our friends in the anti-corruption movement. Uh, since we are debating on a certain regulation on, we want the prison to release more people in the COVID-19, but our colleagues in anti-corruption movement is not really into that for various reasons relating to Indonesia's history of corruption. But let me close my time here with that work that my organization did, AKSI Indonesia, which is translated to Indonesian Act of Justice. So we're a small group. We're just 7 people now. We're based in Bogor, satellite city from Manila. Sorry, from Jakarta. We of course have to handle the case from Jakarta as well sometimes. And as you can see, I put 3 pictures that may explain to you what these 7 people who use drugs did in Bogor, Indonesia. The picture in the left one is we assist people who use drugs that have to encounter law enforcement and sometimes rehab centers that demand money and things like that. On particular, the picture on the third one is 2 protesters at the, I think, like May Day related protests, and then they were caught by the police because they tested positive for drugs, and then they bring those protesters to rehab centers. Those rehab centers ask for money and things like that, but then we intervene and we try to get them home. We succeed that night, and I'm still proud of that night. The pictures top and the right top is when we had some kind of trainings for many women who use drugs. There's also transgender women who use drugs as well. It was a cool initiative. We gain more friends. We understand more experience about women who use drugs, which is often neglected in this often very masculine field of drug policy. And below is Axis Paralegal. was asked by university students about their live experience as people who use drugs, as paralegals, as a community that want to change policy, current policy with simple things that we can do on the field. I think our initiative is far from perfect, but I'm really proud of it, and I think I wish many community of people who use drugs have a similar initiative to do simple things that they can to provoke change in anywhere you are. I think that's my part, Gloria.
Yeah, thanks a lot, Yohan. We really love hearing about what AKSI is doing. They're an organization led by people who use drugs, and it's very. I guess we could all imagine how difficult it is. I mean, we've heard like the challenges over the last few days of, even having kind of good health and harm reduction and other social services available for people who use drugs. And then for people who use drugs to be able to mobilize and gather and then to then help each other. I think for them to be able to do that is incredible. And I think one maybe simple thing that we can all do, whatever position we are in, is to support their agency and their efforts to help and protect each other and the community. Just kind of progressing along. The next question we wanted to, and sorry, just to say that, yeah, I saw that there's quite a few questions in the Q&A, and Dr. Sangeeth has been answering some of them. I think if there are others at the end of the session, we'll address them together too. But next one I wanted to look at was, so we've looked at the lessons of criminalization and punishment, and we've looked at how governments in Malaysia and Indonesia and how people affected by those drug policies have kind of responded to those lessons learned about criminalizing and punishing people who use drugs. Yohan and talked about some of the alternatives that have been implemented in Indonesia already, and so has Dr. Sangeeth in Malaysia. And I guess my question, to you is, what others can you think of? Please do feel free to share about what it is that you know or that you've heard of. I know that decrim has been mentioned a number of times already, but there's actually a lot of ideas.
Maybe Gloria, you can continue my slides. I just have a few more on what we have been so.
Okay.
Yeah, so in Malaysia, what we did was, over the last 2 years, we've got a group of experts. We just started gathering everyone who's been in this field for a long time, the community, the legal, the lawyers, the doctors, addiction specialists, academics who've done research. So it's so important for us so we all got together, and this was just our own initiative, and to form together and share all the information and the evidence that we had, and to look at the evidence. And we started drafting on what would be a effective response or alternative to criminalizing drug use in Malaysia, because everyone has been doing a lot of work in the last 20 years in Malaysia on treatment, rehabilitation, prevention. So it was so important that what we realized that drug use and drug addiction is a chronic relapsing disease, and we want to change the focus from it being under the enforcement agencies to shift it to under Ministry of Health. So our main task now is to move drug use under the Ministry of Health. Currently it's under Home Ministry. So the main thing is to shift the criminal offense to an administrative offense, where we can divert them to counseling, treatment, and so important to realize decriminalization is not legalization. Drug trafficking is still a crime. So what we are working at is to remove the criminal penalties. So for drug use and personal use of illegal substances. Yeah, so the example that we always give is, of course, the Portugal model, where they have decriminalized since 2001, and we can see that there was a huge drop in drug arrests and incarcerations in Portugal. More people were accessing drug treatment. There was reduced problematic adolescent drug use, reduced number of overdose deaths, reduced incidence of HIV/AIDS, and the main thing, the fear is that will there be an increase in drug use? So there's no major increase in drug use. And so the way forward that we in Malaysia we're looking at is, one, to set up a multi-sectoral commission on drug policy reform. That means different commissions on health, where the experts in health, legal professionals, addiction experts, academia, civil society uh, uh, are able to work in the different aspects of substance use. The 5 committees, one, to work on expansion. The most important thing is that before we even think of drug policy reform, we need to strengthen treatment and prevention in the community. So expansion of treatment, expansion of harm reduction facilities in the community, championed by the Ministry of Health. So Health Minister's roadmap includes reinstating harm reduction task force. We want to strengthen the task force in Malaysia for the harm reduction and primary care infrastructure, for methadone, NSCP screening, initiate a working group on public health evidence-based prevention strategy. Like, we know that we've been doing a lot of prevention, spending a lot of money, but we want to work towards more evidence-based strategies now. Education, training, building capacity, advocacy, law, policy review and reform, law minister. So we need to have a commission on with the law ministers department, to have a roadmap to include launching medical legal task force to review the laws, suggest evidence-based public health reforms, impact on stakeholders and the legal challenges. And then the very important part is also to reduce the stigma, to decriminalize, to reduce the discrimination in the community. We need strong public relations, media strategy to support decriminalization efforts through media, social media, television, strategic branding, advertising, to educate the community on the FAQs, to reduce the stigma, to increase community mobilization and call for action. And in everything we do, that we emphasize on evidence-based, so a strong research, data, monitoring, and evaluation system. And lastly, reallocation. I know all this takes a lot of money, of course, to reallocation of resources from criminal justice system to health-based treatment and to support services. So we've had good support from many of our ministers, and the political will is so important, to work with the government, to work with the ministers, to come up to get their support. So I think this is just a small overview of what the roadmap that we are looking at in Malaysia.
Awesome. Thanks a lot, Dr. Sangeeth. Yeah, it's amazing. It's really great to see kind of like a real live experience of all the kind of detailed steps that you could take to kind of further explore the possibility of decriminalization in your context. And it's really amazing that Malaysia has done, I think more so than other countries in Southeast Asia, has done a lot more research on the impacts of criminalization and punitive approaches to drug use, such as compulsory drug rehabilitation centers. And I mean, even outside of Malaysia and Indonesia, there's quite a few other countries in the region that have done quite a bit. I mean, in the Philippines too, I guess I know that yesterday, Dr. Benjamin Reyes, I mean, he mentioned the plea bargaining scheme. Be interested to, we'd love to hear more from different people working in this context in the Philippines, how you feel it's working. For us, I kind of, Dr. Caitlin Hughes, Professor Caitlin Hughes, she's from Australia, and her and Alex Kent, another academic from the UK, they've done quite a bit of research and analysis around on decriminalization and other models which are alternatives to criminalizing and punishing people for drug use. They kind of laid out these 6 broad categories. So they'll put, so they looked at countries around the world that had these different kind of alternatives in place, and they laid out 6 broad categories where they would fall under. And I think perhaps, from what I understand, like plea bargaining in the Philippines would probably be under depenalization. So you haven't removed criminalization, and in fact, you have to be criminalized and convicted before you can avail yourself of drug treatment or drug rehabilitation programs. So you're still criminalized and you're still punished. It's just perhaps a reduced level of punishment because maybe it reduces your time in prison. Yohan before mentioned this diversion scheme in Indonesia, where it's relying on police and courts to help make decisions to divert people who are arrested for using drugs into some type of treatment or rehab. And I guess also the day before we heard from Dr. Wan from Vietnam, and she talked about decriminalization in Vietnam. And actually China and Vietnam have decriminalized already. They've removed criminal penalties. But one of the main problems is that they are administrative penalties instead. And they involve detention, like being locked up for years in a drug rehabilitation center, where it's really not different, or it's even worse than imprisonment. So the punishment is still very much there. So if you're going to decriminalize, I think it's really important to think about how are you decriminalizing and remembering your overall aim. Like what at the end of the day are you trying to achieve with these alternatives? For us, we always encourage going back to, I guess, those principles of harm reduction, where your number one objective is the well-being of the person that you're talking about, of people who use drugs, that you at most important that you care about is whether they're okay, whether they're fine, whether they're healthy, or it could be other issues that they're dealing with, such as underlying trauma, or lack of access to being able to find a job. Dr. Kaur talked about the importance of people being able to find jobs and what a difference it makes. And I'm sure that's something that's easy for all of us to identify. So I guess we're come to this question, like, so when we look at alternatives, including in the Philippines or other, whatever context that you're in, like, how are they working? I mean, our session is short, so we only have like 10 minutes left. Please do share in the Q&A or in the chat box. And I think because we only have 10 minutes left, maybe.
So to answer the Q&A?
Yeah. Let's go to the question and answers in the last few minutes we have.
Mm-hmm.
Did you have something you want to answer, Yohan?
Yeah, there's several things. I think this is from me, but it's really interesting for me. Do you provide what after services do you provide to people who have finished their rehabilitation programs? Do this include reintegration to the community even if the PWD did not choose abstinence as goal? Okay, cool question. First of all, Indonesia's position is abstinent. It's not really stated by the law, but we can interpret it like that. But in my point of view, if you're like a recovery or a rehab person, I think if you see your client using less drugs than before, for example, they usually use 7 days a week, and then now it's only Saturday night, I think that's also something to celebrate, quote unquote. And I think reintegration for that kind of progress, it's also important because it will help her or help him to have a more productive life in a sense. I think in Indonesia the aftercare services is mostly, I think, jobs, so they provide like job training, or for example, but I don't really sure about the effectiveness because after the training they don't really go into a certain industry that the training provided, for example. So there's a missing link of that. And if you want to make a job training as a, I don't know, as a aftercare services from the state, how they go into the industries also have to think about by the policymakers. There's a question from Anon. Does this criminalization punishment also apply for people that stop using drugs but continues to sell drugs for income? I think the notion of decriminalization that happened in this forum is for people who use drugs. That is the main concern, because many countries in the world, it's still putting people in prison or rehabilitation in the mandatory sense just because they use drugs. That is the main concern. For people who sell drugs, it's not really the narrative for this, and I think the law is still applicable for them. And if so, the most important thing I think that I want to add is that for law enforcement, you have to also put into consideration the socioeconomic status or situation of the person that dealing drugs as well. If it's only for day-to-day livelihood, for example, you can prosecute them, of course, but it's need to be different from people that manage the trade from up down, if you can understand it. So
can I add to that? Like,
of course, Gloria.
Yeah, I mean, I think this is exactly the kind of questions that that we're really talking about and trying to think through, because on one hand, we don't support, I mean, generally, I don't support incarceration, or like when we're looking at, we've been doing in recent years more research into incarceration, like trying to understand not just the data on how many people are in prison for drugs. It's a lot. Like in Thailand, where I'm based here, over 80% of people here are in prison. And Thailand has like the biggest prison population in ASEAN. They're huge numbers, like over 300,000 people are in prison, over 80% for drugs. And I think the question has to be, the questions asked is not just who should be in prison, and not just why are we putting them in prison, but also how, like who's making these decisions and how are these decisions being made, and are they fair? Because from what we understand from talking to many colleagues here and in the Philippines and in Indonesia, that the processes, there are so many aspects in which it is not fair. The next session that I understand Kathy from Street Law and Nana from Street Lawyers in Denmark will look at. So I guess this will be picked up in their session. But I think the question has to be asked. If we think that some certain people should be in prison, then we have to ask then how are the processes working that are deciding who goes to prison and for how long? Do you trust those processes? Are they fair? Like when you look, even access to a lawyer is incredibly difficult if you're someone who uses drugs, if you are poor, if you are stigmatized in other ways, if you are from an LGBT community, if you're a transgender person, if you're a sex worker. All those things are compounded. And then your experience of the criminal justice system is more likely to be unjust, and the outcome that you're going to get is going to be more unfair. And I think I really want to, here encourage asking more questions about this. Looking at the drug laws, are the drug laws fair? Are the penalties fair? Like, understand it's a minimum, is it 10 years under the Philippines drug law for possession of any quantity? And then possession over a certain quantity is then assumed to be for selling. Was that person really selling, or were they just in the wrong place at the wrong time? And I think a lot of that discussion needs to be had before we go and talk about who should be in prison, as well as asking why. Sorry,
Cool, Gloria.
No, I think
I just want to add something to the lawyer aspect that you mentioned before.
Right.
Gloria raised an important thing about lawyer. That is what drives us AKSI as well. Since by the law, the existence of lawyer in the court is mandatory, but do they understand people use drugs? Do they understand the scene, the live experience that people use drugs has to face, and the challenges that we have to face? I think that is also that's why we want to create this initiative, because we discuss with our clients in terms that we both understand, and we can understand her or his situation, and that helping us both in both ends, I guess.
Yeah, that's why I just want to. It's so important because there's a lot of good work like Caitlin. She's done threshold studies. We really need to go back to the basics of uh, the threshold values now. How do we calculate the amount that this many grams is this penalty? So it has to go back. She's done some fantastic work on threshold studies. We need to do the threshold studies to look at the laws again. We need to classify if it's a user dependent, because now it's just general. Yeah, and I think the main takeaway is that we must remember that we are not legalizing. We don't drug trafficking is still not tolerable, and for the people who use substance, incarcerating them is not just impact on them, but they're codependent. By putting a breadwinner in prison, you're actually the whole all the codependents are affected, the children, the wife, the family. So I think 1 hour is not sufficient to discuss all this. It's going to take a long time
Yeah.
to discuss
Yeah.
all the factors.
Oh, but thank you for raising that too, Sangeeth. Yeah, and I think definitely the impact of incarceration on families is a huge thing. Yeah, there was an article on in Thailand that always stuck with me, and I'm sure it's the case in other countries that we're talking about here. It's about orphans of the drug war, in that there are so many people who are in prison in Thailand that in some cases a child has both a mother and a father in prison, and what happens to those children. And I know that there's similar of children, the impact on children in the Philippines. Can I maybe in the last few minutes, there's one question I think maybe we didn't really answer. It's from Jaira Anolin. And he asked, based on your experience of undergoing drug war in your country, do you think that the drug war here in the Philippines is achieving its goal? And what do you think is the negative psychological effect on both the user and society?
This short answer, if I may, Gloria.
Yeah. Yeah.
I don't know. I just read the Philippine situation, right? I don't live there, and it's hard for me to imagine how to be on the field today, or like let's say 1 year, 2 years, or 3 years ago. It's too complicated for me. But what kind of response to if that's happened in Indonesia? Let's say in my context, I know for sure it's only moving people from one substance to another substance. So I don't know. I think the rate of alcoholism will be higher, for example, and the trust in general from public to the state to the police. If you see the color of police cloth, it's not giving you comfort. You fear them. You afraid that they will do something to you. And in an extreme case like what happened in Philippines, I don't think it's in the long run will benefit the relation from the public and the state, because it built mistrust. It built I don't know, a certain belief that the state can do anything to you if they want.
Right.
And that's really dangerous moving forward as a country or as a democratic entity. I don't know, but that's just 2 cents of my mind. I just hope it doesn't continue. Thank you.
Thanks, Yohan. Dr. Sangeeth, did you want to
Yeah.
comment on this? Yeah.
I just want to say I hope someone is studying the impact of the policy at the moment, and I'm sure there will be a lot of hard lessons learned, and I think it's true these hard lessons that I hope that someone, people. There will be awareness one day for sure on the impact that this policy is the policy currently in Philippines, and just hope for the best.
Hmm. Thank you, Dr. Sangeeth. I mean, I guess the stated goal of the drug war in the Philippines by the current administration is to make the Philippines a drug-free country. I mean, that's at least the stated goal that I understand, right? And it's the same. I mean, ASEAN still has a goal of ASEAN becoming a drug-free region. Yeah, but I mean, the UNODC is the only kind of body that comes up with regular data on supply and demand, right? And even recently, their most recent reports keep talking about, even during COVID, even during these times, the seizures that are being made have broken records of the previous year, and they keep going up, like the volume of seizures. It doesn't mean that you're catching more of it and there's therefore less of it out there. It doesn't actually. If you were to ask law enforcement, like, they would only ever say they assume that they usually end up seizing around 10% of what is out there. And because it's criminalized, you'll never really understand the full picture of how many people are using drugs, what drugs are they using. You can only get an indication based on some kind of anecdote, unless you do like really invest in really good research on this, which actually not many governments do that. And the data that is usually provided is through law enforcement, people who've been arrested, people who have been made to go into a compulsory drug rehab center. That's where the data that is being captured is coming from. So I think even from the data that the government produces, it would show that it's not working, that even with such a harsh response in the Philippines, you still have, I guess I haven't seen, so maybe someone please correct me. My understanding was that there are still drugs that are seized in large amounts. And there's no indication that people are not using drugs, even in light of the pandemic. But I think I also heard from the first day that somebody said, well, what are the actual goals of for a government when they wage a war on drugs? I mean, it's been well documented in the US that when Richard Nixon declared a war on drugs in the 50s, it wasn't going after the drugs, it was going after Black people. It was a racist goal right from the start. But you can't say we're going after Black people. We can't say that I'm cracking down on you because you're Black, but I can say I'm cracking down on you because you have drugs on you. And then they only targeted certain drugs, cannabis, for example, and crack cocaine as opposed to cocaine powder. And I guess I've seen comments in the past about questioning this in the Philippines. What is the government? What is the real actual goals of the government? And it is to assert their power. And I think maybe as advocates, the most important thing that we can do is to continue shedding light that brings up and challenges what they say from our standpoints of expertise, whether it's as an academic doing research, whether it's as a lawyer, whether it's as a person who's impacted by and has had firsthand experiences of drug policies. There's another question. Maybe someone coming in. Hello.
Yes, good afternoon.
Good afternoon.
Yes, just to share a comment on the ongoing discussions, it's quite interesting.
Yeah.
Regarding the incarceration and what the Philippine government has been doing. By the way, I'm Jail
Right.
Chief Inspector Xavier Solda from the Philippines. First, we have to be clear on the purpose of incarceration. Basically, to prevent the person from doing another harm and undergo reformation or rehabilitation programs. In the Philippines, we've already shifted from that punitive approach way back to rehabilitative or reformative one. In the Philippines, we apply a whole of nation approach. All agencies that could be part of the reformation programs are putting concrete efforts on the process. Like for the Bureau of Jail Management and Penology, wherein we are handling or managing the persons deprived of liberty who are basically remand prisoners, we applied the therapeutic community modality program. We invited the Department of Education for the support to basic education, at least for the PDL to complete the basic education requirements. We have the vocational and technical trainings, the support from religious service providers. We do values formation efforts. So every efforts that each government agencies can be pulled in to support the those offenders are really working hard, no, to help these drug offenders. That's all. Thank you.
Thank you, JC Inspector Xavier, for all the work that you do. I understand it's a challenging situation in the correctional institutions in the Philippines, and it's hard. And thank you for all the hard work that you and your team continue to do. I think that what we're trying to raise here is around the long-lasting impacts of people who go to prison, and how that goes with them, stays with them even after they leave prison, and also questioning to what extent should they be forced to reform in the first place, and when they're away from their families, the impact that has on their families as well.
I just wanted to add one thing, that because of the change in the drug use now on synthetic drugs, meth, so we always get these questions like all these criminal activities outside, rage and murders, and they blame it on drug use. Yes, I agree that it's effects of the psychotic events that take place from drug use is because we are not able to channel them to treatment early. And if someone's using meth and we put them in prison in the early stage instead of referring them for treatment, it's not going to help his psychotic episodes because they need treatment. So every time they come back, so incarcerating them in prisons will not help the drug-induced psychosis. So to say that the crime is done because they are taking drugs is not really true. It's because they are not getting the treatment early, and they should be referred to treatment instead of prisons.
Thank you, Dr. Sangeeth. I think we should wrap up, but maybe a final comment from Yohan.
Yeah, just this is the final to wrap up. I just want to send my I just want to say thank you to the organizers. I think this is an important initiative. I just want to close this by saying that people who use drugs is not like against government or things like that. People who use drugs want to work with the government, and to achieve that, I think we should be friendly towards each other. And imprisonment is not friendly. Police baton is not friendly. And I think if we change the nature of the relationship between the community, people on the street with the law enforcement, I think many things will develop from there. The health situation, the law enforcement situation, the human rights situation. I know it's a long shot. Let's try from somewhere, I guess. Thank you.
Thanks very much, Yohan. Thank you, Dr. Sangeeth. And most of all, thank you for everyone who joined today. And we hope to be able to continue these kind of conversations with you elsewhere.